What's up, guys? We're back with Shit I Feel Strongly About. I'm Dr. Meghan Wieser, a physio coach at Recharge, and this is episode 10. I don't know if this falls really under the Shit I Feel Strongly About, like, realm of, like, why I started all this, but I'm giving you an update. I had surgery on my wrist, so now I have a plate and like 6 or 7 screws in there to align the fracture. So it's now more stable than it ever will be. But I thought it might be helpful for some of you to go through just like the process of, leading up to surgery, the surgery, acute recovery from the surgery, and then kind of what we're doing now. So I am almost 3 weeks. I am almost 3 weeks post-op from the surgery. So I guess going through the process of surgery, let me back up a second here. You have to fast. So no eating, no drinking, nothing. Which actually was not as hard as I initially thought it was going to be. The hunger part of it, the not drinking water was so hard. But anyway, that's a process for surgery, for most surgeries anyway. And the reason for that is for anesthesia. Because when you're under anesthesia, or if you're going under general anesthesia, your like automatic body functions can be suppressed or are suppressed essentially, and they don't want you to aspirate. So there's actually a reason for it, for you to not drink and eat. I feel like not everybody knows that, and they're just told not to drink and eat, and people may or may not follow it and not know why. But that's the reason why. So, and then you meet with a bunch of doctors and nurses and stuff. The anesthesiologist comes in, the surgeon comes in, gets you prepped for surgery because you're going into a sterile environment. So yeah, I had to like wipe stuff all over my body the night before and the morning of so that my skin was sterile. And then they do the rest of that before you go into surgery. So you meet with basically the whole team that is going to be the operating room with you. And then I remember going under the anesthesia, but it was more like they were like, "Did you feel that loopy medicine in the hallway?" And I was like, "Yeah, I feel a little off right now." Um, and then all of a sudden they were like, "Okay," and I remember my surgeon saying, "Okay, have a good nap," and they put the mask thing over me, and next thing I knew, I was waking up back in the pre-surgery center, in my little bed with my nurse next to me. And I was still way out of it. I had a terrible reaction to anesthesia. So everybody reacts to anesthesia differently, and I'm sure there's a whole host of factors as to what makes you act differently or react differently to it, which an anesthesiologist would better answer those questions, obviously. But I've never been under general, so I didn't know what to expect, and it sucked. I mean, that shit blew. I was nauseous. I was dizzy. My surgeon even tried doing like Reiki on me, which I also don't understand. But I'm pretty sure I cursed at my nurse. So Emily, if you're watching this, I'm sorry. I'm from Jersey. What do you want? I'm a strong-willed woman. Anyway, so yeah, coming out of anesthesia was pretty terrible. And then the first 48 hours after the surgery were straight miserable, which I don't think I like mentally prepared myself for. I was planning on my friend picking me up from the surgical center, taking me home. I'd lay on the couch for a little bit and then go to bed. Luckily, she held me hostage at her apartment for a few days and took care of me. And thank God she did. Because the first 48 hours were pretty miserable. And it's hard to do anything. So know that going into any decently major surgery you're going through with it. So I got my elbow back, which is nice. I'm now in a brace. Initially coming out of the surgery, they had this like giant bulky dressing on me and I had a sling. And I followed up with the surgeon 10 days after the surgery. And he did a wound check, changed the steri strips over the scars. And then they fit me for this brace. And they said I could start therapy in another week, which was last week I started. And then I'm following up with the surgeon again in another month, which will be the 6-week point from when I had the surgery. So I should be a little bit farther along. Now the pain has significantly subsided. It just feels weird as hell. Like doing anything. I mean, like I can move my fingers now without any issues. Um, and I can, open and close them and whatnot, which is exciting. It's hard to straighten them out. All these little tiny things that you would not think about being hard are hard. And I've experienced muscle failure, like to fatigue on like, push-ups, squats, deadlift, whatever. I've experienced muscle failure in that sense. This isn't even failure, I think, isn't even the right word. It's just my muscles are so weak right now that even just trying to get anything out of them is so painstakingly hard and effortful. I mean, with the faces I've been making with PT, you would think I was trying to pull 300 pounds off the floor. But then if you think about it, it makes a lot of sense, right? Like our hands do everything, right? So I went from probably 30,000 reps of these things doing something every single day to 0. So I think that is probably a little bit different than like a bigger joint surgery, like a hip replacement or a knee replacement. I have a new appreciation for those big surgeries, believe me. But the fine motor control, getting that back, there's just so much going on here. It's like literally going from like 1,000% to 0 and then trying to get back up there. So my mindset going into the surgery was, okay, I'm getting the surgery. It's going to be fixed. I'll be out for a few months. It's fine. My mindset after the surgery, I think I finally came to terms with how long this is actually going to take to heal. And I've felt like a potato in every sense of the word. Emotionally, mentally, physically, everything. I've felt like the first time I got up and took a walk, it was like, thank freaking God I can move. I just felt like, meh. And obviously there's good times to do nothing, and like my body needed rest, right? Like my body is still in a state of repair. I still need to not be messing with my calories. I still need to be eating. Most people think that, oh, I'm moving less, I should probably eat less calories, but no, like your body's in a repair and a repaired state and a stressful state right now, so it should still be getting exactly what it was. So you shouldn't be in a deficit, all that to say, when you're in a injury repair state. Rehab has been interesting. In this stage, it's so acute. I mean, I've only had 2 sessions right now, but it's a lot of manual, and basically like swelling reduction is a big goal right now. I'm not even 3 weeks out yet. So around week 3, 4 is when I should start to see more significant swelling reduction. And so the big focus is like swelling reduction and early tolerable movement of all ranges of my wrist. So think like flexion, extension, radial deviation, ulnar deviation, grip stuff. That's going to be huge. It's been a lot of work actually, even on my forearm in a manual sense. But it's interesting because like I'm moving my wrist maybe like this much, and it takes so much effort. Which I think I expected to a degree, but part of me was also like, nah, it'll be fine. So getting real with things has been interesting, to say the least. But yeah, right now, rehab is mostly swelling reduction and getting as much tolerable range of motion as possible. Still a little early to be pushing into things like, wincing and whatnot, and trying to force stuff, which will come within the next couple of weeks, I'm sure. But yeah, that's my update. I am now a bionic woman, so I'm harder to kill, obviously, because I have metal in my bones. So yeah. I'll keep giving you updates. We'll get back to regularly scheduled programming, probably within the next couple of episodes. But wanted to give you guys an update on the process of getting surgery and where everything's at. If you guys want to subscribe, Go right ahead. More content to come.